Welcome back to Nerds Horizon Online. Today we are with top tips in 5 minutes. Join us to rebuild your pathways of success. Today's subject is Psychiatric Nursing, Part 1 Introduction. Before watching the video, please subscribe our channel and press the bell icon for everyday notifications. Have an orientation of the beginners of psychiatry. Father of moral psychiatry is William Tuke and Philip Pinile. Father of psychoanalysis is Sigmund Freud. Father of American psychiatry is Benjamin Rush. Father of psychology is Wilhelm Wundt. And the mother of psychiatric nursing is Hildegard E. Peplow. In this slide, the most important famous personality is Sigmund Freud, who is the founder of psychoanalysis, and William Tuke and Philip Pinile also as a father of moral psychiatry. Schizophrenia. The term was coined by Eugen Bleuler. The book The Mind That Found Itself was written by Clifford Beers. The organization Alcoholics Anonymous was founded by Bob Smith and Bill Wilson. Electroconvulsive therapy was introduced by Hugo Kerr-Latte and Lucio Binai. In this slide, the most important 2 points are: schizophrenia was coined by Eugen Bleuler and ECT by Hugo Kerr-Latte and Lucio Binai. Psychiatry in India, certain milestones. In 1912, Indian Lunacy Act was passed. 1982, Indian Mental Health Act. 1987, National Mental Health Program. 1996, District Mental Health Program, which was a part of 9th 5-year plan. So we have certain tips: 1912, 1982, 2 acts ending with the digit 2. And 1996, if you reverse 6, it becomes 9, so which is a part of 9th 5-year plan. At last, the recent amendments, which is Mental Health Bill, was introduced by Government of India in 2016, in which decriminalizing the suicide and ECT allowed only with anesthesia was the major recommendations, and it was came into force in 2018 July 7. Let us remember some of the milestones of psychiatric nursing in India. In 1956, 1-year post-certificate course at NIMHANS has been started. 1965, psychiatric nursing added in BSc nursing. 1975, psychiatric nursing has been added in MSc nursing. 1986, psychiatric nursing added in GNM. 1991, ISPN, Indian Society for Psychiatric Nurses, established. Please remember, 1956, 1-year course. 65, it is added in the BSc nursing. 75, it is added in the MSc nursing. Some of the theories: most common theory, that is personality theory, in which Hippocrates for humor theory, talking about certain fluids imbalances. Kretschmer's theory, talking about body physics. Sheldon theory, again talking about body physics. Carl Jung theory, talking about social interaction. In this slide, most important is Carl Jung theory, which describes a person into extrovert and introvert based on their societal interaction. Now, psychoanalytical theory by Sigmund Freud: oral stage, anal stage, phallic stage, latency, and the genital. In the phallic stage, the person is in a conflict of Oedipal and Electra complex. That is the only most important finding. Again by Sigmund Freud, the contribution topography of mind and interplay of id, ego, and superego. Id is based on pleasure seeking principle. Ego is based on reality principle. Superego is based on morality or the perfection principle. Third most important theory is psychosocial development theory by Erik Erikson, which is starting from infancy, in which the psychosocial conflict is trust versus mistrust, and in the toddler period, the conflict is autonomy versus shame and doubt. Continuing with the psychosocial development theory by Erik Erikson, in the preschooler, the psychosocial conflict is initiative versus guilt. In the schooler period, industry versus inferiority. And in adolescence, identity versus role confusion. And in young adulthood, intimacy versus isolation. For these 4 age period, the code is initiating industry for identical intimacy, which is a most common question. So please remember initiative, industry, identity and intimacy. During adulthood, the psychosocial conflict as per this theory is generativity versus stagnation, and in the older age, ego integrity versus despair. Please remember, elderly period will be having ego integrity versus despair. Let us wind up today's video. The question of the day is, the role identification is concerned with which of the following psychoanalytical stage of development? And the options are oral stage, phallic stage, latency stage, genital stage. I repeat, the role identification is concerned with which of the following psychoanalytical stage of development? And the answer is option B, phallic stage. We have the rationale for the question. Oral stage deals with the development of trust. Phallic stage deals with the resolving Oedipal and Electra complex by identifying the role of the parent. And the latency stage starts with the peer group identification, that means the same sex group identification. At last, genital stage deals with the questions about opposite sex sexuality. Thank you for watching our video. Join us to rebuild the pathways of your success. Thank you.